The mission of the Retina Institute is really quite simple. We're there to give you the best, the most advanced retinal care available in the context of your full body disorders as well as your retinal disorders, such that by linking it all together, there is no base unchecked.
Call the Retina Institute at 504-455-0500 in Metairie to schedule your retinal eye evaluation.
Had no vision problems, no blurriness of vision, and no anything, no floaters whatsoever. And then one night, it just started to happen, and I couldn't see out my left eye.
I was at work one day, and I just felt this real funny feeling in my eye, like something was just in there, and I couldn't see it. And I kept thinking it was my hair, so I kept pushing my hair on the side. Well, later I found out that it was a floater. And then the next day when I got up, I just couldn't see out of that eye at all. It was just totally black.
When I first noticed it, I had a problem was when we were driving on the highway, and the trucks in front of me looked like they were kind of slanted sideways. That's how I first knew that I had a problem.
All of a sudden one day, I noticed that when I was just reading regular script, that it was somewhat squiggly. And that was the real telltale sign that something was wrong.
A retinal specialist specializes in the part of the eye that involves the retina and the vitreous. The retina in particular is the wallpaper inside the eye. It's actually brain tissue, so it has a special place in terms of its significance of disease, the gravity of disease, and a special relationship with full body disorders such as high blood pressure and many others. So in diagnosing retinal disease, we often rely on a knowledge of what is going on in the full body as far as those list of diseases that the patient may be dealing with, in figuring out what is going on in the retina, and in treating the retina, we often rely on better treatment or a change in treatment of the full body disease in order to benefit the health of the retina. It is critical for patients with diabetes specifically, but also with other full body disorders, including autoimmune disease like rheumatoid arthritis, lupus, and even simpler disorders like high blood pressure, to be getting regular eye exams. The reason is there can be significant damage in the retina. If you take diabetes, for instance, it is a disorder which at its worst is literally not compatible with life. It is a metabolic disorder where your blood cells are literally not as well capable of using the food of life, which is sugars in the bloodstream. At its worst, not compatible with life. Now, even though a person may not have the most severe full body level of disease in diabetes, they are still, if the disease is not fully controlled, going to be suffering a slow simmer, if you will, of disease in the retina and in other organs that mimic the retina. So eye exams in particular, and at the Retina Institute we specialize in that, will be able to tell through diagnosis on exam and specialized testing such as scanning laser tests as well as angiography, the level of disease in the retina, and be able to put that together so that we can tell how much the diabetes is affecting the health of the retina. We can take measures at that point to reverse that disease, or at the very least to slow it down, in concert, of course, and this is what we really focus on, with controlling the full body disease.
In the field that I work in doing carpentry, it's important to be at least able to read your measuring tape, which goes down to a 1/16th of an inch. So in a 1/16th of an inch over, if you multiply it several times, you could end up with something that's inches too long or a few inches too short. So it's pretty important to be able to see down to a 1/16th of an inch, which is something I couldn't do before I came to see Dr. Ebrahim.
Macular degeneration is a disease that affects the retina in a very particular place, and it is the most important real estate in the retina, if you will. It's the part of the retina that is responsible for the finest central vision. That's what really makes it a devastating disease. It tends to hit older people, and the tragedy of it is that after working a full life, when hitting retirement, many of these patients are debilitated then by this central vision loss. The way the disease works is that it is a simple degeneration in most people of the retina and the tissues beneath it at the center. That's called dry macular degeneration. But a certain percentage, a smaller percentage, about 10%, will progress to wet macular degeneration, which is a more severe type, and even though it's only 10% of the disease, is responsible for about 90% of the vision loss because it is more aggressive. We've actually gotten very good at treating the wet macular degeneration with medicines that basically are able to help the disease regress. So the transition in wet macular degeneration is involving a growth of new blood vessels under the retina in this central location, unfortunately, which then are leaking and bleeding and causing significant scarring, sometimes very quickly. Again, that links back to the need to diagnose retinal disease quickly, which cannot be done unless the patient comes in. The things the patient wants to look for at home is a change in the central vision in either eye, so you want to check the eyes separately such that straight lines are wavy, or if there is anything missing in the central field of vision, there is something called an Amsler grid, which can be found on our website that you can download and look at with one eye at a time at about 14 inches, which is very useful in early diagnosis. The most sensitive test for macular degeneration is in fact an angiogram in the office, which helps us to tell the difference between dry and wet, and then initiate proper treatment. Proper treatment in macular degeneration and even wet macular degeneration has given people a 90% chance of either keeping or gaining vision. That is a phenomenal statistic, something that was not available even less than 10 years ago. So the treatment options for macular degeneration, when the dry form is present, which is the majority, is mostly preventative options, such as a certain type of supplements, generally considered to be 3 that I use, that slow retinal degeneration. That field is always changing and improving, and as it does so, if the patient is plugged in, they can benefit from more preventative care. There are in the pipeline treatments for dry macular degeneration that may literally be able to stop the degeneration and even reverse it. That is not currently available, but I believe will be available quite soon. For wet macular degeneration, the treatment is already much more robust in the sense that we can deliver treatments which frequently are given monthly or even less frequently. That's been very effective. It's very satisfying to deliver that treatment because patients really do benefit on a large scale. Like we said, 90% of people can expect to either maintain vision or even improve vision.
Every now and then I'll run across someone who says, "Oh, my grandmother has the same thing," and I'll say, "Does she go to somebody?" Because, you know, there's stuff you can do. There are procedures that are not that evasive, that will restore your eyes. Maybe not totally, but tremendously. They'll put you back on your feet. They'll give you your life back.
So we've come a long way in macular degeneration. We have a lot to offer. The biggest obstacle now tends to be patients not getting into treatment early enough.
If you've been diagnosed with diabetes or macular degeneration, you should protect your sight with regularly scheduled retinal eye exams. The Retina Institute maximizes preventative care with the most advanced specialized technologies to minimize visual decline and the need for future procedures. With a convenient location in Metairie and a soon-to-be-open main office at I-10 and Causeway by Lakeside Mall, it's easy to schedule an appointment. Call the Retina Institute at 504-455-0500 for premier retinal eye care.
A number of disorders that affect the retina are working like diabetes in the sense that they really put a large stress on blood vessels, eventually hurt the lining of the interior of very fine blood vessels that perfuse the retina and other organs in the body. When these blood vessels break down, you're literally witnessing a patient outliving their blood vessels. It's a very scary thing to see. And you're watching the retina, which again is brain tissue in the eye, lose blood flow and begin to slowly drift off and not function. That is a permanent and, in many cases, irreversible disorder when not caught early. So for diabetes in particular, we rely on the A1C very, very much. And we're surprised sometimes to find patients that have had diabetes as long as 30 years that don't know what the A1C is or don't know even what the term is. So I'll explain what that is. The A1C is a blood test, and it's used on just about every diabetic to follow the control of the disorder. It tells you in that one number about a 3-month average of the control of the blood sugar. So unlike an individual pinprick blood test, which tells you the blood sugar at that moment in time. An A1C will tell you the 3-month average. Therefore, it will take into account all peaks and troughs, and it's a much more reliable number when you want to follow the overall control of the disorder. That's critical to us because we know that if you keep that A1C at a reasonable level, typically at 7 or below, that the patient will have a reasonable expectation of not worsening in terms of retinal eye disease.
Actually, I was having problems with my retina for a few years, but never knew it. And so I didn't know it until I actually had some bleeding behind my left eye.
There is great success. This has been studied for decades now, and there are even long-term studies showing how patients that have had diabetes for 30 years and received treatment 30 or even 40 years ago have progressed now, and they've done great. The treatments have reversed the trend of vision loss and maintained the vision that the patient had. That's what's so satisfying about it. Again, there can be a great trend among some diabetics towards noncompliance. But I'd like to tell my patients the burden is not just on you to watch your diet, although that is a great burden and it is absolutely critical if you're going to do well. But there are medicines available which can help you control your sugars and your blood pressure, and that's all essential so that you do not drift off into unnecessary retinal disease.
I have uncontrolled diabetes, which I'm trying desperately to get under control. So he always suggests, have you seen your endocrinologist? And he'll also have high blood pressure. He makes sure that I'm seeing my primary care doctor. He's just very caring. You feel like you're not just going to a doctor, it's just someone who cares about you and what your outcome is.
Any even subtle vision loss in a diabetic should be taken very seriously. You can, as in macular degeneration, use the Amsler grid. However, you should not rely on visual changes to get in and see your doctor. You have to have the regular exams. It is absolutely possible to have the most severe form of diabetic retinopathy and to still have an almost perfect central vision. We do see that, and these people are, in essence, hanging by a thread with their central vision, although the entire peripheral retina is basically dead, and there are even retinal detachments present that the patient has simply overlooked because their central vision is so good. If you have diabetes and you're between eye exams and you notice even the slightest bit of visual change, you must be seen. You can't just wait to see if it gets better, because there's some fast-moving disease in diabetes, and that is something that is typically able to be stopped should you come in quickly.
I've been fortunate that, whenever he does the laser surgery, I'm not losing any of my vision. All that's remaining intact, thanks to him being able to do the surgery. And the most important thing now is to get my diabetes under control.
Dr. Ebrahim is he's very conservative, he's very caring and professional. He looks at all aspects of your life, your activity, your health, to see how it's going to affect your eye, and he has basically kept an eye on things. He's been there if I've ever had any problems, and he is conservative in the fact that he doesn't want to do any treatments unless they're absolutely necessary.
I believe hypertensive retinopathy is one of the most overlooked subtypes of retinal disease. High blood pressure, as I've said before, is controlled in only about 27% of Americans, which is a starting point that is a little bit lower than optimal. Consequently, we do see plenty of hypertensive retinal disease. Now, that comes in different forms. There is sometimes basically the slow stress that happens uniformly and diffusely on blood vessels in the retina, and that can lead to a slow demise of the vasculature in the retina and therefore the health of the retina. And conversely, there can be events in the retina, such as strokes in the retina. They happen as a result of chronic high blood pressure, and they can involve bleeding in the retina, and fluid in the retina, swelling in the retina, and a decline in vision. There are excellent treatments now for the strokes in the retina and the swelling that results in a reversal of the vision loss if caught early. plenty of good treatments, including laser and other medical treatments, as well as, of course, attention to the full body disorder that 9 out of 10 times is the cause of that stroke in the retina. So we check blood pressure on every patient, every visit. And the correlation with the impact on retinal disease in particular is really impressive. There are few large-scale bleeds in the eye, for instance, that we have not been able to relate somehow to at least a spike in blood pressure, if not a consistently high blood pressure. And this gives us great ability to prevent future loss of vision and future such episodes by getting to the heart of what is really causing this retinal disease, not just in the eye, but in the full body.
He was the first doctor to ever address my blood pressure, so now I'm on blood pressure medicine. He monitors that. He stays on me about that every time that I go to see him. You know, it's through all the years I've never been diagnosed with that, or anybody has ever brought issue to that. But he says that is very, you know, it can have a strong effect on the eyes.
Sometimes I'll go in and my blood pressure may be elevated a little bit. He say, well, Mr. Grew, did you take your blood pressure medicine today? Yes, sir, I took my blood pressure medicine, Dr. Ebrahim, you know, but he's really concerned, I think, you know, about his patients. And like I said, I really, really do trust him with my eyes.
We see a lot of patients that complain of floaters in the eye. It's one of the things that really drives patients quite crazy over time. But the floaters themselves, I like to explain to people, are not the disorder. They are, however, a very, very important symptom that people can recognize at home that can be indicative of some very serious disease in the eye, including retinal tears and detachments. The retina is like wallpaper in the eye. The gel in the eye is the vitreous, and it's connected to that wallpaper at birth. As we get older, that gel likes to collapse in on itself and pull away from the retina. It's a natural process. There's nothing wrong with it. During that process, you tend to see shadows of particles floating through that gel, and that's floaters. In some people, during the process of separation of the gel from the retina, it will maintain too strong an attachment and pull a tear in the retina, which can lead to a retinal detachment, which is very serious and potentially blinding.
It's been 8 months and my vision has retained its old vision, what I would have seen before, so it's really good.
You should understand that not everybody with floaters has a retinal detachment, so we don't want to alarm people in that regard, but you do have to have somebody lay eyes on the retina to make sure that it's not damaged.
Without my eye surgery and Dr. Ebrahim in the Retinal Institute, I was unable to perform my duties as a driver.
Dr. Ebrahim received his MD from the Georgetown University School of Medicine, then returned to New Orleans for ophthalmology training at Tulane University. He then studied retinal microsurgery under the most published retinal surgeon in the history of the field. Dr. Ebrahim founded the Retina Institute in 2005 to provide premier retinal eye care to patients in Metro New Orleans and beyond. For more information or to schedule an appointment in Metairie, call 504-455-0500.
In the process of discussing macular degeneration and wet macular degeneration in particular, we discussed medical treatments. That includes Lucentis and Avastin, which have really changed the field of treatment for macular degeneration and now many other disorders, including diabetic retinopathy. Well, there are many other medicines coming down the pipeline. Some medicines like VEGF trap and others will concentrate on doing the same job that these other medicines have done, like Lucentis, but in depot formulations. What that means is that there will be slow-release treatments that will require fewer treatments less often, but still give hopefully the same benefit and control of the disorders that we have with other medicines that we have available now. That field is really changing rapidly in a medical sense. There are thousands of researchers working at all times in the field of retinal care and retinal disease. Now, it's a very slow process in filtering out all these new possible treatments and finding out which ones work, and then eventually some of those actually get delivered clinically in the office, but only if they're found to be not only effective but safe for patients. It's something we take very seriously. My personal interest is in stem cell research and the factors that can actually stimulate regeneration of the retina. I find that to have much more of a future in my mind than artificial implants. And in that regard, I think that for many of the disorders that we treat now, like diabetes, macular degeneration, the hypertensive eye disease, retinal detachments, macular holes, uveitis, etc., there will actually be a host of factors that we can apply either directly in the eye or as pills for full body disorders that can help regenerate even eye disease, and for implantation of stem cells directly in the retina or under the retina or in the eye somehow to help regenerate retina and really reverse retinal disease on a level that we're not capable of yet. Smoking has been found in numerous studies to really have a direct negative impact directly on diabetic macular edema, on macular degeneration, and uveitis and other eye disorders. These studies are constantly coming out, and I think that the common link there is that smoking increases inflammation throughout every tissue in the body, and the eye is not excluded from that. Inflammation, not infection, but inflammation, is at the heart of many disorders that we look at in the body, increasingly so with more and more research. And smoking, increasing that inflammation, is really moving us in the opposite direction from the direction we're moving in of most preventative measures such as antioxidants, etc., which decrease inflammation. Many treatments that we give directly in the eye, such as Lucentis and Avastin and other medications, are designed specifically to reduce inflammation. And so again, smoking is sort of a counterbalance in an area of inflammation, taking us in the direction that is the exact opposite that we need to in order to not just keep these diseases from getting further, but in many instances, preventing their diagnosis and their onset altogether.
Dr. Ebrahim is very cautious about, he just over and over again tells me what I need to do. And some of the things are hard for me to do. I'm a smoker, and he is very, very graciously, encouraging me to give that up, and I am trying. Dr. Ebrahim gave me some vitamins to take, which I didn't know there was a vitamin for your eyes.
There's a very dedicated staff at the Retina Institute that really are a large part of the excellent care that we're able to deliver at all of our locations. These are people that I rely on very much, and the patient comes to rely on. We have been with me for many years, most of these people. They are very skilled in taking the patient through the process from beginning to end in a comfortable, respectful environment with great attention to their disease process and the state of mind that comes with being worried about your disease process. That's something we take seriously. We really try to walk people through that as kindly as possible.
The staff has always been wonderful, yes. I could call them the staff at the Retina Institute. And I guess I've been there so many times they know exactly who I am. They're, okay, Ms. DeGroot, when do you want to come in?
I love his staff. His staff is very professional, very caring. They're always calm. They're always reassuring. They know you by name. They will work with you if you need to change your appointment. They are always there to help you, and they ask about your family and your children. And Dr. Ebrahim also, he's very professional, very calming, reassuring, and I feel he's very knowledgeable and I trust him.
Everyone in my family has brought me to see Dr. Ebrahim, and he takes the time to explain, show the pictures that they take of my retinas. He explains everything to them so that they're able to understand, because when somebody can't see through your eyes, it's hard for them to understand, what's going on with you, and he takes that time to explain all the pictures and, encourage me to, lifestyle changes and the vitamins and such. At
the Retina Institute, we're privileged to receive referrals from other doctors and other eye doctors, mostly in the area, for our specialized retinal care. We really try to stay in close connection with those doctors and treating the patient, letting them know our findings, keeping them apprised of the care of the patient in the context of their overall care of the patient's eye care. And for primary care doctors, their care of the patient's overall medical status. At the Retina Institute, there are many treatment options available, all of which really require a good diagnosis to start with. And that starts the cascade of figuring out what is particular to that patient and what their particular needs are in terms of therapy, whether it be a laser, medical treatment, or surgery in the operating room. That is the process that is the job of any retinal surgeon and that we take pride in at the Retina Institute. The mission of the Retina Institute is really quite simple. We're there to give you the best, the most advanced retinal care available in the context, as we've stated, of your full body disorders as well as your retinal disorders, such that by linking it all together, there is no base unchecked. And when you leave the care of the Retina Institute, it's our goal to make sure that there really is nothing more that could have been addressed either in your retinal disease specifically as treatment in the eye or in treatment of your full body disease to give you the absolute best outcome. Our feeling is that if at the end of the day, no matter what happens with your outcome, you and us can look back together and know that we did everything we could, then that's the most satisfying way to handle things.
My vision is so important to me. I have children, and I want to be there for them all of the, throughout their lives, and to be able to be their mother.
My vision is getting better with all of this procedures, and I'm hopeful.
To get to the type of eye care that we have at the Retinal Eye Institute and Dr. Ebrahim is worth the drive. It's a godsend that he was putting on my life.
The best thing about having the Retina Institute in this community is knowing that I have a professional such as Dr. Ebrahim that I trust with my vision help.
I would not go to any other doctor. I would recommend him to just about anybody and everybody that I see, because I see quite a lot of people, and I would tell them, I really do trust him.
Very thankful to have found Dr. Ebrahim, because eyes are very important. I do not want to go blind.
And for a quick visit to a specialist like Dr. Ebrahim, and it may change your life.
If you've been diagnosed with diabetes or macular degeneration, you should protect your sight with regularly scheduled retinal eye exams. The Retina Institute maximizes preventative care with the most advanced specialized technologies to minimize visual decline and the need for future procedures. With a convenient location in Metairie and a soon-to-be-open main office at I-10 and Causeway by Lakeside Mall, it's easy to schedule an appointment. Call the Retina Institute at 504-455-0500 for premier retinal eye care. Dr. Ebrahim received his MD from the Georgetown University School of Medicine, then returned to New Orleans for ophthalmology training at Tulane University. He then studied retinal microsurgery under the most published retinal surgeon in the history of the field. Dr. Ebrahim founded the Retina Institute in 2005 to provide premier retinal eye care to patients in Metro New Orleans and beyond. For more information or to schedule an appointment in Metairie, call 504-455-0500.